Hair transplant is not about more hair. It's about predicting your correct age. This is Dr. Vaibhav Shah. I am a board certified maxillofacial surgeon, hair transplant surgeon and facial cosmetic surgeon, Mumbai, India. And one of the most known destinations for a hair transplant is Mumbai. One of the commonest surgery, the cosmetic surgery, is hair restoration. The reason is, it is just not about having a more hair. It is just not the restoration of a hair. It is also the restoration of a age, restoration of a smile, and restoration of a confidence. You can check out in this guy. Generally, due to the male pattern hair loss, when someone loses the hair in a very early age, they lose confidence. And when you do the transplant, you restore the confidence back. Well, it was the 15th of March 2019. In the morning, there was a big headlines on almost all the newspaper. The 42-year-old man died after a hair transplant in Mumbai. Believe me, that day I saw the fear of a death. Almost all the patients, they have cancelled the surgeries. I was getting calls from my other colleague doctors. They were asking me what happened, what went wrong. And there was a fear everywhere. So what was that? Why somebody died? Was it because of a transplant? No. It is never because of a transplant. Well, when we do, we have to understand the science behind it. When we do the surgery, we have to make the donor area and the recipient area numb. So when we perform a surgery, patient do not feel pain. So this is the solution which is called as a lignocaine, which we use it during a surgery to make it a numb. There is an ideal dosage. In a simple language, I would like to say you cannot use more than 30 ml. You can't use more than this much amount of a bottle in anyone within the 24 hours. Effect of this particular medicine remains for 4 to 5 hours. In 4 to 5 hours, one can do around 2000 to 2500 graft. So if at all you want to go for a more number of a graft, you want to go for a 4000 or 5000 graft, better you split your surgery in 2 days. Make sure you are not doing the overdosage of a lignocaine. Also, always follow the standard protocol, which ensures the safety of a patient. So generally in our clinic, when we have a mega session, we do not have a mega session, we split it into 2 micro sessions. And even patients should not insist their doctors for everything in a one go. The technique of a hair transplant. Well, almost every patient asks me, like, which technique you will gonna do, doctor? There are so many techniques, like a strip method, punch method, then you have a biostimulated, then you have a direct hair implantation, you have a modified hair implantation, you have aesthetic hair implantation. So which one you are gonna give me? To be honest, we are not selling you the mobile phones and we are not selling the cars. Every 6 months, we cannot have a new model. It is basically a punch method and a strip method. With a minor modification, the different name is given to it. But by and large, what we use is a punch method. The cost of a hair transplant, one of the most commonest question by everyone. Well, the cost depends on only one factor, that is expertise of a surgeon. Always there is someone who sells it something for very cheap, and there is someone who sells it for little more expensive. It's only upon you and your individual choice which one you select. But basically, you get it right from the so-called 10 rupees graft or even 5 rupees graft, and it goes up to even 3 lakhs or even 5 lakhs for one hair transplant surgery in Mumbai.